Thank you. I'm Jenn Gordon, and I'm a patient living with EGPA since 2014, and I'm a co-principal investigator of the Vasculitis Patient-Powered Research Network. Thank you to Professor Sid and Carmen and the organizers for the opportunity to be here today. And I also want to thank my fellow patients for sharing their stories. I really appreciate that. So I'm going to talk a little bit about the VPPRN, which is slightly different than the other two registries we heard about. But I think we have some similar message we've been hearing today, and that is that patients need to participate in research. And our doctors are here at the International Workshop to collaborate together. And as patients, we can support them, and this will also support us. Anybody here a member of the VPPRN? I see one other person, two. Hopefully, the message today for us to participate in research is coming to you, and I hope you'll consider to join the VPPRN. We have information out at the booth where you can find more information to join here, and also about some of the other studies that we're doing. So what is the VPPRN? We are online, patient-centered, collaborative, international, and I think I can show you we have been very productive and I think successful. We are a network of patients, researchers, clinicians, advocates, and family members, all focused on helping to understand what is happening to us, people living with vasculitis. Here are some of the people that are involved in the network. My co-principal investigator, Dr. Peter Merkel, will be speaking next. He's here to participate in the conference. And then there are others, our collaborators at the Vasculitis Foundation. Christine Young, who is the network manager. Without her, this would not be possible. And then there are a number of people behind the scenes that handle our data. This is very important, as you heard from Julie, that we have data protection in place. This is something we take very seriously. You can read about our data policies online. We have a mission to do research to find the answers to questions that are most important to patients living with vasculitis. Our membership here is almost 5,000, and you can see we have every type of vasculitis represented, even the very rare forms of vasculitis. We have over 100 patients of each type. We have global membership. Most of our members are in the United States and in English-speaking countries because it is an English registry, but we are looking to expand our membership. This is our current membership in Spanish-speaking countries. Those of you who are proficient in English, please, I encourage you to join. What do we do? Our goal is to collect data. The typical data you think about, your medications, your symptoms, your diagnosis, what doctors you saw. And then we also are very focused on patient-reported outcomes. The information we've been hearing about today, fatigue and pain, and how your well-being is. What are the symptoms that are the most challenging for you, the most impact on your quality of life? This is information collected directly from us, the patients, about how we're doing. And there have been publications showing the information we provide is just as accurate and sometimes even more accurate than what the doctors provide about us. We have many studies. I'm going to give a few highlights of some recent ones. These are studies that will be at the International Vasculitis Workshop, one on quality of sleep. You heard Dr. Satui talk about the Vasc Strong study earlier today, one on neurological involvement in ANCA-associated vasculitis, and another one on mind-body and vasculitis. All of these will be presented, either oral presentation or poster presentation at the workshop. After the abstracts are submitted, usually a publication is coming soon after that. And if you are a member, you can sign up for our newsletters or go to our website, and you'll find information on all of these publications as they come out. Ongoing studies, we have a registry for EGPA and disease-specific types of vasculitis. We have the VPRN Registry. Dr. Satui talked about that, and I'll mention it more in a moment. And we have another one about predictive analytics. How can we use electronic medical records to help predict people who may have vasculitis, to help them get diagnosed faster? This is very important, I think, for all of us who have been through the journey. I will tell you here that these will also be 2 oral presentations about VPREG coming out. So VPREG, there's a flyer out at the desk. I think this is really a very exciting study, important for people who wish to have a healthy pregnancy, to learn what we know about those of us who are undergoing pregnancy now and the outcomes, and we'll provide information that you can learn for yourself what the options are, and that you can also share with your doctors, especially if they're not experts in vasculitis, so they can learn and connect with a specialist that can help you to have a healthy pregnancy. It is possible. And it's in Spanish, so please, I encourage you to participate. Some of our recent publications, this is just a list of many. You can find them on our website. We actively publish, and one of the things I'm very, very proud to say is that all of these publications involve a patient, at least one patient, as a co-author. I have been a co-author on some of these, the studies I was involved with. We ask for patient research partners at every step to participate in the design, the study, the analysis, and the publication. This is a patient-driven, patient-powered network. So if you're interested in participating in the research, please take a look, and you can find more. Upcoming projects, Mind-Body, a clinical trial, vasculitis across the lifespan, which is for pediatric, sinonasal symptoms, and a study on ANCA maintenance therapy. Many of these are the topics of grant submissions for funding and will be upcoming publications in the future. We're working on a pediatric registry. This is very important to understand, very understudied area. What happens to those of us diagnosed at a very young age? The VPREG registry is expanding to more countries. And we're working on an app to help patients enter information and help them with other things such as symptom tracking. Who can join? Anyone with vasculitis can join, or if you're the parent of a child with vasculitis, or if you're the caregiver, you can join for an adult patient with vasculitis. You only need access to the internet and English proficiency. Why should you join? I think we've talked about that a lot today. It's so important that we have those of us represented from all areas of the world with all types of vasculitis in all stages, because it's our data that will lead to new research and new understanding of treatments for vasculitis. It's very important for us to give data back to the community, so we also now have a dashboard. You put your information in, we ask you how you're doing the last 6 months, how are you feeling, how is your pain, how is your fatigue, etc. And then you will be able to see what everybody in the network reported anonymously and how you compare, and that what people with your type of vasculitis are reporting. So I can see, is my pain level similar to other people with EGPA? I can look at my own numbers over time and see, is my pain level changing over time as I go in and enter the data? We're looking for feedback of what kind of information we want to share with each other and to continue to build. And I have Uncle Merkel here. We want you, please. We hope that you join the registry. Thank you.
Thank you very much. Are you planning to translate into Spanish? That would help a lot of people in the audience. I guess some of them would like to participate.
Yeah, right now it's a difficult question because we have to translate all of the forms. There's very complicated medical history questions. And then what do we do with the data and how do we compile from different sources? But I think that's where the VPREG, as we translate into many languages, we can see like a prototype. Will this work? And then if something like this works and we have interest, then we will try to scale. Or maybe we can partner with other groups and find ways to do this.
Any question? So he's asking that if the patient exclusively the patient introduced the data, which is yes, right? But he also comments on the fact that some patients with Takayasu, which is the disease he has, have also Crohn or other autoimmune disease, and how is you are certain whether fatigue or whether malaise or whether other complaints come from one disease or the other.
Yeah, that is an excellent question. So as patients, we get everything else, not just vasculitis. And this will affect us over our lifespan. And you have what they call comorbidities for everybody. So there may be people who get cancer more frequently. How do we know if we don't build a database and look for this information? So we do ask the question if you have any other health concerns, and periodically we may go back to try to collect that. But we also build this network which is entered by the patients. So if a researcher or a clinician wants to ask a question, is there an association with Takayasu and a particular Crohn's disease? Then we can go to the network and do a study, and we already have the information from all the patients, and then you go and the doctor sets up the research study. We have a patient research partner. The study is organized, and then you ask very specific questions about Crohn's, family history, whatever information you want, so you can collect that and do a study.
So we patients, we give our data to you, and you ethically have them and use them. So, and I understand these are studies or trials that you have initiated and you use our data. Is our data used by clinicians outside this? So can a clinician that does the research in another country contact you and you can support them using our data?
Any study has to go through the approval process and has to have human subjects approval. If someone outside of, let's say, the United States wants to do a study, they need to submit a proposal. This gets evaluated by the team, and then if it's deemed acceptable, then it gets to the next level of review. And if we say we want to do the study, they have to meet all the ethical requirements. Right now, all of the data is stored in a US-centric, secured data center, a little different than what Julie described, where they have different registries that are linked, but it is possible to potentially have different registries that could be used for the same study. You might need to have ethics approval at each individual registry. But the data would not be available unless it were approved as a project and met all those standards.
Thank you.
I think we have time for maybe one more question, or we probably need to move on. Joyce is nodding.